Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I'll give a brief overview of what you need to know about atrial fibrillation. In particular, I'll cover what is atrial fibrillation, how you treat atrial fibrillation, and how you can live better with atrial fibrillation. Well, first of all, over 40,000 people in Ireland have atrial fibrillation. And unfortunately, atrial fibrillation is responsible for 30% of strokes in Ireland. So it's a pretty big issue for the Irish health system. So first of all, what is atrial fibrillation? During atrial fibrillation, the heart's two upper chambers, the atria, beat chaotically and irregularly, out of coordination with the two lower chambers, the ventricles of the heart. Atrial fibrillation is an irregular and often rapid heart rate that commonly causes poor blood flow to the body and symptoms of heart palpitations, shortness of breath and weakness. Atrial fibrillation can also cause fatigue and stroke. It's often caused by changes in your heart that occur as a result of heart disease or high blood pressure. Episodes of atrial fibrillation can come and go, or you may have chronic atrial fibrillation. Although atrial fibrillation itself usually isn't life-threatening, it is a medical emergency. It can lead to complications. Treatments for atrial fibrillation may include medicines and other interventions to try and alter the heart's electrical system. A heart in atrial fibrillation doesn't beat efficiently. It may not be able to pump enough blood out of your body or around your body with each heartbeat. Some people with atrial fibrillation have no symptoms and are unaware of their condition until it's discovered during a physical examination. Those who do have atrial fibrillation, symptoms may experience palpitations, which are sensations of racing, uncomfortable and irregular heartbeat, or flopping in your chest, decreased blood pressure, weakness, lightheadedness, confusion, shortness of breath, and chest pain. Atrial fibrillation may be occasional in the case. It's called paroxysmal atrial fibrillation. You may have symptoms that come and go, lasting for a few minutes to hours and then stopping on their own. Or you could have chronic. And with chronic atrial fibrillation, symptoms may last until they're treated. Possible causes of atrial fibrillation would be abnormalities or damage to the heart structure are the most common cause of atrial fibrillation. Other possible causes of atrial fibrillation include high blood pressure, heart attacks, abnormal heart valves, congenital heart defects, an overactive thyroid or other metabolic imbalance, exposure to stimulants such as medications, caffeine or tobacco or alcohol, and sick sinus syndrome, which is an improper functioning of the heart's natural pacemaker, or emphysema or other lung disease, previous heart surgery or viral infections, and stress due to pneumonia, surgery or other illnesses, sleep apnea. However, some people who have atrial fibrillation don't have any heart defects or damage, a condition called lone atrial fibrillation. So moving on, next is how do you treat atrial fibrillation? The treatment option best for you will depend on how long you've had atrial fibrillation, how bothersome your symptoms are, and the underlying cause of your atrial fibrillation. Generally, the goals of treating atrial fibrillation are to reset the rhythm or control the rate of the heart rate, prevent blood clots, and they're the two main goals. And to correct your condition, doctors may be able to reset your heart to its regular rhythm or sinus rhythm using a procedure called cardioversion. Cardioversion can be done in two ways. The cardioversion with drugs. This form of cardioversion uses medicines called antiarrhythmics to help restore normal sinus rhythm. Or you have an electrical cardioversion. In this brief procedure, an electric shock is delivered to your heart through paddles or patches placed on your chest. After electrical cardioversion, Antiarrhythmic medications often are prescribed to help prevent future episodes of atrial fibrillation. Commonly used medicines include amiodarone, propranolone and sotalol. Sometimes atrial fibrillation can be converted to a normal heart rhythm. The goal is to slow the heart rate to between 60 to 100 beats per minute. Heart rate control can be achieved two ways. Medications, so you'd atrioventricular node ablation, so either of those two ways. And finally, how do you live with atrial fibrillation? So you may need to make lifestyle changes that improve the overall health of your heart, especially to prevent or treat conditions such as high blood pressure. So we'd suggest that you eat a healthy or heart-healthy diet, reduce your salt intake, which can help lower your blood pressure, increase your physical activity, stopping smoking, avoid drinking more than 1 drink of alcohol for women or more than 2 drinks for men a day. And finally, before I finish, there are numerous products available at Lynch's Pharmacy here in Douglas and Cork to assist you in managing atrial fibrillation more effectively. Products we can supply to get you started on an exercise plan, such as exercise balls, floor mats, weights, and various equipment required for weight-bearing exercises. We also have numerous supplements which can be taken to help maintain your cholesterol at an optimum level. These would be psyllium husk, CoQ enzyme 10, flaxseed and omega fish oils. We also supply heart monitors, skipping ropes, pedometers and smoking cessation products. So that brings this video to an end. Customers of Lynch's Pharmacy can have avail of a brand new telehealth clinic service where we help you to better understand your condition, and together we create a cohesive management plan which enables you to take an active role in managing atrial fibrillation with confidence. Call into us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 and find out more. Thank you for watching. Stay healthy and stay informed.